Our PSA is on mono, and it'll cover what it is, how it spreads, treatments, and why it's important not to get it. So mono is usually caused by the Epstein-Barr virus. It most frequently occurs in young adults and teenagers, but it's pretty common with 3 million cases per year in the US, so really anyone can get mono. You can get diagnosed by a healthcare professional by either describing your symptoms to them or doing a blood test for antigens. The symptoms of mono are similar to any other viral infection. These include fever, head and body aches, sore throat, etc. These usually improve within 2 to 4 weeks and aren't too severe. Occasionally, fatigue will last longer than those 4 weeks, and in extreme cases, a swollen spleen can lead to it rupturing, but this is pretty rare.
Now that you know what Epstein-Barr virus and mono are, what can you do to lower your risk of getting it? Well, there's no vaccine against the virus currently, so our best bet is to just make lifestyle changes. My favorite example is Snoop Dogg's lifestyle. Snoop Dogg's lifestyle should pretty much be avoided at all costs. It's a great way to get mono by sharing drinks, kissing strangers, sharing smoking paraphernalia, and sharing food like he does on his most famous cooking show. All of those things really increase your risk of getting mono, so try and avoid Snoop Dogg's lifestyle. However, it can come from more than just saliva. A lot of people think that mono comes just from kissing because it's famously known as the kissing disease, but it can also come from a number of other things, including semen. Dorothy Crawford found that the way mono is most commonly spread on college campuses is actually through unprotected penetrative sexual intercourse. So, using a condom can really reduce your risk of getting the virus. In summary, ways you can protect yourself is just not sharing. Sharing is not carrying with this virus. Try to avoid sharing saliva, organs, blood, or semen. I recommend not sharing cigarettes, drinks, kissing strangers, sharing food or toothbrushes. And also just try not to get an organ transplant or blood transfusion from a sketchy place. And use a condom or just abstain from having sex in general to reduce your risk of getting the virus.
How is mono treated? Currently, there's no treatment for a viral infection like mono. Doctors typically recommend over-the-counter antibiotics such as ibuprofen to help reduce symptoms. Symptoms such as a sore throat, fever, or any other type of pain. This is why treatment really only involves self-care. This means that getting sleep, eating healthy, and drinking lots of fluids to stay hydrated is very important when having mono. Although most people recover in 2 weeks, some people can have symptoms such as fatigue last from 3 to 4 weeks. Mono vaccine. Currently, there is no vaccine for mono. The monovirus hides in cells, which makes it hard to attack. The monovirus also triggers a rare type of cancer called Burkitt's lymphoma. This cancer starts in the immune cells called B cells and is a fast-growing type of cancer and can be rapidly fatal if left untreated. This is why any vaccine created can also have the potential risk of carrying this type of cancer. Researchers continue to work against this problem to try and create an effective vaccine for mono. For now, all you could do is try to stay healthy and away from mono.
Preventing mono is important because the symptoms don't occur until a couple weeks after contraction, which means you can pass it on to others without knowing, and they can pass it on to other people without knowing. There are currently no medications and vaccines to prevent mono other than medications that help relieve symptoms, which often prove unsuccessful. One of the two most common symptoms is fatigue and swollen lymph nodes, which can be very painful while eating, and you don't want to be remembered as the person who passed mono to someone else.